We know that there have been very exciting updates with antibody-drug conjugates. Dr. Alyssa Cooper will speak to this more. And so just to introduce this in small cell lung cancer, this is like a Trojan horse. You can see here in the bottom panel of the circle that ADCs are antibodies that are hooked to chemotherapy. And the antibody is unassuming. The small cell lung cancer takes it in like a Trojan horse, and the chemotherapy is then released inside the cancer cell like a missile to deliver chemotherapy to the areas that are of need, which is the small cell lung cancer. There are many exciting targets. I'll only speak to one today, but what we can see is that for small cell lung cancer, there's very exciting drugs against TROP2, which is Ifinatamab Deruxtecan, B7H3, which I'll speak to, which is the Daiichi compound 7300 or I-DXd, as well as SEZ6, which was ABB011 and reformulated to 706. So speaking to I-DXd, we see that patients have, this was a study that was presented earlier this year at World Lung, our conference on lung cancer, and that they saw that 2 doses of I-DXd, 8 milligrams or 12 milligrams, seem to have similar improvements in helping control the disease and helping to improve overall survival, and that there might be a hint with the 12 milligram dose being more beneficial. We saw that the response rate actually was doubled from 26% to 54% with the increase in the dose. And so the 12 milligram dose is really the dose that will be explored further. What we see is that, again, the intracranial or the brain responses from brain mets with these diseases, with these treatments with I-DXd and antibody-drug conjugates, we see it working in the brain, that 66% of patients and 50% of patients on the 8 and 12 milligram doses had responses in the brain as well as in the body. And so this is very exciting that this can go into the brain and help fight cancer in the brain.